241, a 26-year-old patient in the gynecological ward complained of pain and swelling in her episiotomy stitches on her second postnatal day. On examination, the localized swelling, redness, foul smell, and pussy discharge were identified at the stitches site. After examination, the nurse checked vital signs BP 116/28 HR 132R, R28 TEM 39.8. Which of the following should the nurse do prior to the patient examination by the gynecologist? A. To arrange dressing instrument. B. Maintain patient privacy. C. Arrange stitch removal kit. D. Collect detailed. The answer is B. Maintain patient privacy. 242. A 28-year-old prima gravida who is pregnant at 16 weeks attended at the emergency department because of dark brow discharge. Investigation showed a decline in pregnancy test for which of the following is the most likely type of the spontaneous abortion? A. Missed. B. Threatened. C. Incomplete. D. Inevitable. The answer is A. Missed. 243. A nurse is educating a prima gravida woman who is pregnant at 30 weeks on breastfeeding. Which of the following statement by the woman indicates that she needs additional teaching? A. Breast milk can store it at room temperature. B. Breastfeeding should be based on baby demand. C. Baby can be held in different ways during feeding. D. Breastfeeding helps the uterus to return to pregnancy size. The answer is D. Breastfeeding helps the uterus to return to pregnancy size. 244. Which of the following vaccines should be given to a 9-month-old? A. Hepatitis. B. Varicella and measles. C. Oral polio and Bacillus ceolmate-guerin. D. Measles and meningoconjugate quadrivalent, MCV4. The answer is D. Measles and meningoconjugate quadrivalent, MCV4. 245. Nurse is instructing a female client how to do breast self-exam. Which of the followings is the best time to perform this exam? A. After ovulation. B. After the period. C. 2 weeks after period. D. 3 days before period. The answer is B. After the period. 246. A nurse is explaining pudendal block anesthesia to prima gravida women who is in active labor. Which of the following relief areas identified by the woman would indicate that teaching was effective? A. Back. B. Perineum. C. Fundus. D. Abdomen. The answer is B. Perineum. 247. Which of the following classifications of placenta previa is applicable when the placental edge is 5 cm away from the internal cervical os? A. Total. B. Partial. C. Marginal. D. Complete. The answer is C. Marginal. 248. A post-date pregnant woman is admitted for the induction of labor. Her fetal heart rate and vital signs are within normal range. Her intravenous line is maintained, and she is to be started on low doses of labor-inducing medication. Which of the following medication the mother is likely to receive intravenously? A. Oxytocin. B. Servidil. C. Cytotec. D. Cytoxin. The answer is A. Oxytocin. 249. Which of the following patients are at risk for cord prolapse? A. Fetus that remains at high station. B. A mother with oligohydramnios. C. Presenting part at station plus. D. Intact membranes. The answer is A. Fetus that remains at high station. 250. While taking care of the patient with a spinal cord injury, the patient suddenly complains of pounding headache. Upon assessment, the patient was found to have diaphoresis, drop in heart and elevated blood pressure. Autonomic dysreflexia is suspected and the head on the bed is elevate. Which of the following is the most appropriate to important immediately? A. Notify the physician. B. Assess bladder for distension. C. Continue to monitor for next hour. The answer is B. Assess bladder for distension. 251. Vital statistics and control of communicable disease serve many function. Which of the following is the basic function for health? A. Public. B. Mental. C. Education. D. Maternal and child. The answer is A. Public. 252. A 6 months old infant mother decided to wean her child. Which of the following is the best principle of weaning process? A. Start the weaning process by 8 months of life. B. Gradually replace one breast session at a time. C. Discontinues the nighttime feeding first. D. Allow the child to take a bottle of milk or juice bed. The answer is B. Gradually replace one breast session at a time. 253. A midwife is conducting a health education session to the primigravid mothers. The session is about antepartum care to ensure the health of the mother their babies. Which of the following statement made by mother suggest their appropriate understandings of antepartum periods? A. Beginning of labor till the baby birth. B. Diagnosis of pregnancy till the baby birth. C. Last 3 months of pregnancy. D. 40 days after the child is born. The answer is C. Last 3 months of pregnancy. 254. A 41 weeks pregnant was admitted to labor and delivery unit for induction with oxytocin infusion. 3 hours later, her contraction are 5 to 6 in 10 minutes and strong. Which of the following is the best nursing action? A. Gives an analgesic. B. Stop the oxytocin and inform the doctor. C. Gives psychological support. D. Change position to left lateral. The answer is B. Stop the oxytocin and inform the doctor. 255. A 25-year woman was admitted to medical ward for anorexia chemotherapy. The nursing diagnosis was imbalanced nutrition less than body requirements related to dysfunctional eating pattern. Which of the following is the best way to evaluate the outcome of nursing care of this patient? A. Record daily weight. B. Monitor vital signs accurately. C. Schedule meals with family members. D. Offer small portions of favorites. The answer is A. Record daily weight. 257. What is the antenatal assessment schedule for women the period of conception and 28 weeks of gestation? A. Once a week. B. Every 2 weeks. C. Every 3 weeks. D. Every 4 weeks. The answer is D. Every 4 weeks. 258. A nurse is instructing a 20 years old nulla gravida woman about side effect of oral contraceptive. Which of the following, if stated by the woman, indicates for further education? A. Nausea. B. Headache. C. Weight gain. D. Ovarian cancer. The answer is D. Ovarian cancer. 259. A 33-week pregnant mother is on her routine medications that include iron supplement, folic acid, multivitamins and calcium supplement. Despite all medication, her hemoglobin has not been increased since last 2 months. She is experiencing more fatigue and lethargy since past few weeks. HB80. HCT 0.22. Which of the following intervention is the most desired? A. Add vitamin C to increase drug absorption. B. Start injectable multivitamins as per regimen. C. Advise increase intake of organ meat and fortified food. D. Advise increased food intake by frequent small meals and snacks. The answer is A. Add vitamin C to increase drug absorption. 260. A primigravida attend the antenatal clinic for her routine visit. The nurse performed an abdominal palpitation and found the fundus to be midway between the symphysis pubis and the umbilicus. What are the weeks of gestation according to this findings? A. 8 weeks. B. 16 weeks. C. 24 weeks. D. 28 weeks. The answer is B. 16 weeks.